Welcome back, everyone. Today, the doctor is in, and we are taking this opportunity to get answers to some top health questions. Dr. Scot Ackerman, one of the First Coast leading oncologists, joins us every Friday to talk about important health topics such as these. Welcome, Dr. Ackerman.
Hello, good to see you.
And I love these questions because they've come from your Facebook page, from the Ask the Doctor on your website, and then just questions that your patients ask you on a regular basis. So we know folks out there are asking these same questions.
All the time.
All right, so we're going to start with gluten. It's everywhere people are talking about gluten-free. So, okay, should people go gluten-free?
Well, Charlene, lots of people are talking about gluten. There's a lot of buzz about gluten. I go to some festivals in the afternoon on the weekends, and you always see the gluten-free products, gluten-free baked goods, and that sort of thing. But you really only need to be gluten-free if you have celiac disease. Gluten is a protein that's found in grains, and in people that have intolerance to this protein, people with celiac disease, this protein will cause damage to their small intestines. But it's only in a very, very small minority of people. It's not necessary to be gluten-free for most people, and it's not really a good way to lose weight. Whole grains are very important. Whole grains are an important, essential part of a balanced diet. They have nutrients in them that are very important for us. In fact, people that have celiac disease and are gluten-free have to supplement their diet with certain nutrients that they don't get because they're gluten-free. And also, whole grains keep you feeling fuller longer and are probably better for you to maintain an appropriate body weight.
And you hear a lot about folks with the autistic community is trying gluten-free.
Well, there's no data that shows that gluten-free diets help cure autism, or that a gluten-full diet causes autism. Some people have tried it and see it. I know people that go light on gluten, and they tell me they feel better. They feel a little bit more alert, maybe a little bit more energy. So there's nothing wrong with dialing back your gluten a little bit. And I talk frequently about going on a low carbohydrate diet or trying to avoid a lot of carbohydrates. So a lot of the grains, the refined grains and flours, are very full of carbohydrates, and you can overdo it on the gluten and that stuff as well. So try to keep things in balance, but going gluten-free isn't necessarily going to help people with autism.
Gotcha. All right, let's talk about wine. Is a daily glass of wine healthy? And I'm Italian, so I already know the answer to this question.
I think so.
Absolutely.
So wine has lots of health benefits. Wine, red wine more than white, but both red and white wine are healthy. But red wine helps reduce heart disease, helps reduce the incidence of stroke, helps prevent diabetes. But on the other hand, studies have shown that too much alcohol is not good. We know that alcohol causes liver damage, hepatitis. Alcoholics have hepatitis, which is very bad, and that frequently will lead to hepatocellular carcinomas, liver cancers, those sort of things. Alcohol is also implicated in increasing a woman's risk for breast cancer, and also implicated in increasing both men and women incidence of colon cancer. So my recommendation is, again, with balance. You want a little bit of alcohol. Wine, wine's good for the circulatory system, the heart, and reducing risks of certain kinds of cancers in moderation. So really, one glass of wine or one drink per day for a woman, and no more than 2 a day for men.
Okay. How about vaccines? Another controversial topic. We were talking about gluten a moment ago.
People ask me about vaccines all the time. We get it on our Facebook page very, very frequently, the whole vaccine thing, especially this time of year, because the flu vaccine is around this time of year. Vaccines are safe. Vaccines are crucial in protecting all of us from dangerous health conditions. When the population of people get vaccinated against a certain disease, it eliminates that disease from society. For instance, polio. Years ago, people were vaccinated for polio. We don't vaccinate people for polio anymore because those vaccination programs eliminated polio from our society. There's lots of rumors about vaccines. Maybe they cause cancer, maybe they cause autism. These rumors are not true. Some vaccines even prevent cancer, like the HPV vaccine.
Okay, let's talk about, I'm surprised you get this question, but you're an oncologist, of course you would. Do cell phones cause brain cancer?
Well, cell phones, people think that because they hold the phone to their head, they're going to get a high risk of brain cancer. This is just not true. There's no studies that have shown that there's any link. There's been lots of epidemiological studies looking at incidence of brain cancers and looking at usage of cell phone usage and that sort of thing. But the bottom line, if you take a step back and kind of look at it from 30,000 feet, what's the incidence of brain cancer today per 1,000 people compared to what it was in the 80s? Before we had such widespread use of cell phones? The answer is it hasn't changed at all. So there is no uptick in the incidence of brain cancer. But if you're concerned about the waves from the cell phones and causing problems, you can use a headset or a speakerphone.
Okay, and finally, aspirin. Is an aspirin a day good for you or bad for you?
I think aspirin is a miracle drug. It's been called a miracle drug by many people. It lowers your risk of heart disease and stroke. It also minimizes your risk or lowers your incidence of colon cancer, stomach cancer, breast cancer, esophageal cancer. But aspirin can cause gastric irritation, can cause bleeding. So if you're sensitive to aspirin, though, you'll know it right away. People with aspirin sensitivity, it's not necessarily dose dependent. They're just as sensitive to a baby aspirin as a regular aspirin. So talk to your physician about it. But we don't know what the dose is that one should take, maybe a baby aspirin or a regular aspirin, or even 2 regular aspirin. I generally recommend 1 regular aspirin a day. Good for helping your heart and also good for minimizing your risk for cancer, but talk to your physician.
All right. Thank you so much, Dr. Ackerman, for the information. Always good. And of course, for sponsoring this segment. And of course, if you have any questions regarding this topic or any other health questions you might have, visit Dr. Ackerman's Facebook page, facebook.com/Ackerman Cancer Center.